Hi there, I'm Dr. James, and I wanted to take some time to go over your syllabus with you for the course so that we won't take class time. That way you can go back and review this video if you have any questions or concerns. I'm going to go over the syllabus for your theory course first, which is Nursing 2044. I'm not going to read the whole thing to you. I'm just going to bring up certain points that are important that you need to know. This is a theory course just like your others. You need to purchase the new book because everything will change. The book is very evidence-based and it's very easy to read, and it's just a very good resource for you for maternal newborn nursing. We will be using class discussion and lecture. I like to also reinforce content with case studies. There will be a skills book that you have purchased. There's some skills for you to review over that will help reinforce the information as well. We'll have some written assignments to do, one of those being your portfolio item that I will talk about in a few minutes. And we'll have some small group activities. There's a group activity that you'll be assigned into groups to do some presentations, similar to how you conducted things in med-surg and psych. This is a course on women's health throughout the lifespan, but emphasis is placed on women and family in childbearing years. We'll talk about the nurse's role and nursing management for women in a labor and delivery setting as well as in a prenatal setting, and how that affects the family through the antepartum, intrapartum, postpartum, and neonatal periods. And we'll talk about how to care for a newborn before the newborn goes home, and then after the newborn goes home. It's a pediatric thing, so you'll have some crossover, but not very much. We try to keep everything pretty clear so that you don't get yourself confused. Of course, you need to see or higher in the previous nursing courses, as well as completion of Psych 2070 and your statistics, because we will be talking about some research, and sometimes you need to know those things. You can look at your course objectives. Of course, each module, each unit that we go in will also have learning objectives that we will talk about to make sure that you are learning what you need to learn in each area. Your topical outline is also listed in your syllabus, and to go along with that you have a course calendar that you follow, and it has your reading assignments in it. So it's very important to follow along so that you make sure you aren't missing anything in preparation for your exams. Your course calendar follows closely along with your book. Is it in sequential order? Not always, because there is content that we feel like is necessary to place in a certain sequence so that things make sense to you. We focus on normal in the beginning. We try not to talk about very many abnormals except to give you a comparison so that you can understand what's happening. And then we focus on high risk and complications more towards the end of the semester, because some things may be very rare, and we try not to get into those very often so that we don't take up quality time of something that you may not see for 30 years or so. Teaching and learning activities, as I said, we'll have some online ATI activities that you will be responsible for doing before you come to class, some critical thinking exercises that will help you know how to do before we get started, a lot of class discussion, and a lot of reading. So it's very important that you read. All the student feedback we receive is, I would have done a lot better had I read. You need to read before you come to class, get an idea of what we're going to be talking about. If you don't prepare, it's very difficult to keep up. We're the same as other classes, 77% or higher to be successful in theory, plus you have to be able to pass clinical. So how the course is evaluated is in your syllabus, and of course you have to score 90% or better on your drug calculation. We will have 3 unit exams, each worth 100 points. And what you may not be used to is how these are weighted in your course. Your unit exams are going to be collectively worth 75% of your final grade. There will be a final exam that is only going to be worth 10% of your final grade. Alternative assignments, you will have some OB alternative assignments. These may be like tickets to class, a critical thinking assignment, something that we will do in class as a form of attendance. Those will be worth 25 points, and then your portfolio assignment, which is called the OB patient experience, those collectively will only be worth 15% of your grade. So you can see you have a total of 475 points, but it won't be 475 divided by the number of assignments. It will be 475 points times whatever percent of the grade each portion is worth. So it's important for you to know that you've got to do well in everything. If you are not here whenever we have these alternative assignments due, you will not get credit for that. These alternative assignments usually require that you be present to turn them in when they're due. And we don't take late ones. They're due when they're due, especially if it's a ticket to class. That has to be turned in whenever the instructor tells you to. On your syllabus, there is an explanation of what these alternative assignments may be. Scheduled simulation activity, that's scheduled, that's something that you know ahead of time that's going to occur and it's on your calendar. Group presentations on STIs, that is on your calendar. That's worth 10 points. Critical thinking maps, tickets to class, those types of things, those will be equivalent to a total of 5 points. Ticket to class today, it's going to be graded, it's a point. Those types of things. So those can come and go as your instructor sees fit. Your final formal project, and you will have specific instructions for that, is going to be a total of 50 points. All of those in total will only be worth 15% of your final grade. All components of these assignments must follow the rubric and they must be present for you to get credit, and you can read all of that. And as I told you, these are not included in the makeup policy. We also take standardized tests in this course. The standardized testing scoring is similar to what it was last semester. If you score a level 2, you get 3 extra points awarded to your final. If the score is 3, you get 4 extra points awarded to your final. So it's important that you do very well. Now, something that is different than what you're used to. Each one of you are responsible for taking the ATI practice assessment prior to a proctored exam. However, this semester, we will not be scheduling when this practice assessment is done. The practice assessments will be open as soon as we all get our access to ATI. And you will be responsible for taking that practice assessment. If you score below a 77%, you are highly encouraged to spend at least 2 hours of remediation on taking that focused assessment and looking at where your deficiencies are. And this will help to enhance your knowledge of course content and do much better on your standardized exam. If you do not take the practice exam, and we will run a report before time for the proctored, and if you do not take it by the due date that we set, you won't be able to sit for the standardized exam and you will receive a 0 on your final exam. So you need to make sure that you keep this in your forefront. I need to take this practice exam at some point. And you need to have it completed in order to sit for the proctored and to sit for the final exam. Okay, and I've also included in your syllabus on how to gauge the weighting of your grade. You take your points earned and multiply it by the weighted percentages to determine what your final score will be. But I also run your grades in Excel, and so anytime you need to know where you are grade-wise, then we will be there. And you can read on how we determine your final grade. The way I do test review in this course is one-on-one. I do not do group test review. If you score below a 77%, or if you want to come by and review your test, you, within 2 weeks after the exam, set up an appointment to come by and see me or Ms. Bradford, and we will review your exam with you. I do not have all-inclusive test reviews with a class. I don't find students learn, and if I have a chance to help you with test-taking strategy or with where your weaknesses are, it's easier for us to do that face-to-face than in a full classroom. And this is after each exam. I won't wait. I don't want you waiting until the third exam and say, I want to come review all 3 of my exams. That won't happen. This is after each exam. If you want to come and review, anyone can. But if you score below 77%, you are required. It's a mandate that you come and set up an appointment and come review your exam. Assignments, you will receive instructions on how to submit assignments. Sometimes we submit them online. Sometimes I just have you hand them in on paper to me in class. And there's more explanation in your syllabus about your different assignments and how grades will be posted. Technical information is still the same as it is in all of your other courses. And we only will be using your LSUA email. That is our way of communicating. You need to make sure you check your email frequently, at least every couple of days. Because excuses of, oh, I didn't get the email, that won't make it. If you hear your other classmates saying that they got an email from one of us, it's very important, if something's up with your email, that you talk to IT and get it fixed, because that is our primary line of communication. The only people that usually end up with my cell phone number are my clinical groups, and that number is usually only used by emergency or my office phone. But email is really our primary way of getting in contact with you. We do follow the LSUA Student Handbook attendance policy. Absence from any class for any reason, avoidable or unavoidable, will result in a loss for the student. When it's excessive, it may be a direct cause of low achievement or even failure. It's very important that you attend class and look at the additional information related to student absences in the 2018 Student Handbook that's posted in Moodle. Sometimes you are sick and you can't help but miss class, but we definitely need an email from you saying, I'm not going to be in class today, this is what's going on. Sometimes we may even require that you bring in a doctor's excuse, so it is very important that you communicate with us of your missing class. We expect you to be on time. Ms. Bradford and I, if class starts at 10, we expect you in your seat at 10, because unless some unforeseen circumstance happens, we are starting at 10. And we do count tardies. If you are excessively absent, you will receive attendance violations, and you will receive attendance violations for tardies. Clinical is mandatory. Usually there is only one clinical that can be missed, and there is still makeup work for that one clinical that's missed. Assignment due dates need to be followed. If there are extenuating circumstances, we expect for you to communicate with us that it is late, and why it is going to be late. And if it's after 24 hours of the due date, we reserve the right to not grade it. So stay in close communication with your instructor so that you are as successful as you can be. I already talked to you about email. All your campus resources are listed in your syllabus. Pay attention to your drop dates. even they're on your academic calendar as well. Your required textbooks again are listed, and we've already told you, there's a new book. You should have paid your second installment for ATI. If you have not, you are holding up the rest of the class to be able to access ATI. So it's very important to get that second installment in. All your previous books are considered your supplemental information, so it's important that you have those and you can access those as well. I'm going to go ahead, sorry, I probably caused some issue there looking at my files. I'm going to go ahead and talk to you about your clinical syllabus, and then we're going to talk about your appendix a little bit while I've got you here on video. All right, clinical. I'm your course coordinator, Dr. Sarita James. Some of you will have Ms. Jill Cruz at Cabrini for your clinical instructor. Some of you will have Ms. Arnold at Rapides General, and some of you will have me in the second rotation at Rapides General. We focus on experience, a lot of experience. We do have some written assignments that we will be doing. And some written assignments, but you're expected to be prepared when you come to clinical. We will have some sim lab experiences as well. And it's all about managing patient care, not only in the labor room, but also postpartum and also the newborn in the nursery. And we focus on quality, safe patient care. You have your topical outline again of what it will be. And we have specific clinical objectives, your clinical evaluation tool, as well as your clinical objectives that I have posted for you. We will have a good simulation day. Students really enjoyed that last semester. You have to have a course grade of at least 77% or higher to pass clinical, and you also have to perform successfully in clinical. We'll be given meds, we'll be doing skills, we'll be doing as many things as we can. That's why I like to have you on the units more than just observing a labor and delivery, which we will do that, and we will do some newborn assessment. But I like for you to spend some time getting into the routine on the units as well, because those are some things that you're going to be doing from now on as a nurse. Labor and delivery is a specialty. Working in newborn nursery takes extra training, and so those are some things that there's no way you would be ready in 6 weeks to go and do something like that. So we try to spend as much time doing patient care as we can. You can read the rest of your clinical syllabus and how you are graded. It's similar to your other classes. Makeups for clinical. If you miss a clinical, you will have makeup work, and it is your responsibility to make sure you find out from me or your clinical instructor what that makeup work will be. If you are late for clinical, depending on how late you are, you may be asked to go home, because it's just like your job. If you're late for your job, everybody else is either having to wait on you to get there to go home, or they're having to wait report on you, and I expect you to be there and ready for report when it starts. Your clinical instructor will let you know what time to arrive. My cutoff is if you're 15 minutes late, you're too late. Most of the other clinical instructors are the same way, because by 6:45 on our areas, report has started. So check with your clinical instructor. Make sure you know who you are supposed to contact if you're running late, or if you've run into a problem, or you've had a flat tire. My policy is that you call the unit that you're assigned to. So make sure that you get the phone number of the units that we're going to be, and you call and let them know, please let my instructor know. And your instructor may choose to share their number with you for you to let your instructor know by a certain time of the morning if something's going to transpire. It's all of learning to be how to be a professional. Your assignment due dates will be given to you. Um, Clinical assignments this semester, I have opened up drop boxes in your clinical sections in Moodle. There will be some paperwork that you will do weekly, which if you've talked to anybody from last semester, it's different. But we feel like this will be better for student success and better form of evaluation that we do paperwork this way. And I'll be talking to you some more about it as time goes on. Here again, we email using LSUA email. Just read over and refer to your syllabus for your theory class on what we're doing. All right, I'm going to go over your clinical objectives with you. And you can pull up these documents along with me as I'm reading. Okay, and these are the clinical objectives for 2018, which if you have documents from anybody from previous courses, these have changed. What your specific behavioral objectives will be in the labor room, in postpartum, and in the newborn nursery of things that we will be doing and what we might expect you to do in post-conference, because we will have post-conference and we're wanting you to learn how to use SBAR. For instance, in post-conference and you are assigned to labor and delivery for the day, give us an SBAR of your client's focused assessment during post-conference. And this is not to put you on the spot or cause you to have some type of punitive score for clinical. This is all to help us learn. So your clinical instructor may ask you just to give an SBAR, or we will give you an example of an SBAR to help you prepare for a post-conference. Medications, calculations, while you're in clinical, you may be asked to show your instructor a couple of medication calculations just for us to stay right there in your face that we understand that you know what you're doing when you're completing drug calculations. What you're going to do, for instance, whatever you're assigned to do for this week, you're going to the labor room. You will be responsible for completing a concept map of one of the problems that you saw this lady having in labor, pain. Complete a concept map for that client, and it's due the following Wednesday to an electronic Dropbox in your clinical setting, in your clinical section. And it's the same type of concept map that you used in psych. This has to be typewritten. The other thing that you will do is to complete a profile and assessment of your client, and that's going to be due into the electronic Dropbox on the following Wednesday after your clinical. Now for labor and delivery, that's a one-pager. The instructions on there, and it needs to be typewritten. And that's going to be due in the Dropbox. The formal project is totally different. So I'm going to talk about that separately. Now your objectives for when you go to postpartum are similar, and you will do the same thing. You will do a concept map due the following Wednesday, as well as a profile and an assessment, which is the paperwork is in those editable forms that's been posted. And those are due on the following Wednesday after clinical. They must be typewritten. And if you're on the unit where you're taking vital signs and those types of things, there's a jot sheet that's included with your paperwork. That can be handwritten, but I would like for that to be uploaded so that I have something to look at to ensure that this was the patient you were taking care of. Now, there is to be no identifiable information on these documents that you are uploading. Just initials will suffice. but nothing to identify the patient. Same thing for the newborn nursery. If you work in the newborn nursery next week and you're taking care of a baby, then a profile with an assessment and a concept map for that baby will be due the following Wednesday into the electronic drop boxes in your clinical section. Concept map, profile, and assessment must be handwritten. The jot sheet, that must be typewritten. The jot sheet can be handwritten and included in there so that I have something to go by. And hopefully all that makes sense. If it doesn't, it's all written in your student learning objectives, in your clinical objectives for this course. Please ask questions. Don't ask each other. Ask your instructors. With your clinical objectives, there's a listing that's called 2046 Tactus List. And what that is your medications, the therapeutic effect, the action, contraindications, the toxic or side effects, and the nursing interventions, as well as what the safe dose is. There is a common listing here of the drugs that we expect you to have with you for a drug report every time you come to clinical. Going to ATI and getting the drug stacks that are in there and printing those off, I'm fine with that. Handwriting them on an index card, we're fine with that. But we expect you to have all of these with you at each clinical experience for whenever we ask you for a drug report. Sometimes there is a drug you're going to be giving your client that's not on this list. We will be expecting you to look them up and get this same information. We are going to be using generic names. Some things I will use both because of what you will hear on the units of what it's called. But we will expect you to have these starting your first clinical day. We also ask that you make a card for normal newborn vital signs and keep that with you so that you know what's normal, what's abnormal. Whenever you go and take a temperature of a baby, we want to make sure that you are aware that this baby's too cold, or this room is too cold for this baby because the baby's temp is below 97. Okay. There is a daily clinical checklist of things that we're expecting you to help with. Make sure that you are doing things, because now you're in second level. So there are things that you've learned to help keep things tidied up. Make beds. Get the patient in the shower. These are things that we're expecting you to do without us having to come behind you, say, hey, have you made your bed yet? Have you given the client a bath? Have you helped him get to the shower? There's some information about your jot sheet. There is a resource sheet there for you that talks about the bubbly assessment, things that you're expected to assess for a postpartum client. What the lochia should look like, and what temperature conversions are, as well as the APGAR. This is a resource sheet for you so that you have an idea of what's expected, and it's just a real quick guide for you to look at. There's a baby care map. This would help you whenever you're teaching mom, if she asks questions, especially if she's a first-time mom, and this is really a helpful guide for you. There is also a help guide for newborn assessments. This is a table that is talking about the skin, arms, legs, muscles, what you're looking at, and what a normal assessment should be. This is for reference only, but it's a guide to help you look to see, okay, did my baby have any Mongolian spots? Are these normal, abnormal? What do they look like? This is a good guide that would help you do that. Now, going on through that guide is huge. If I were you, I would not print it off unless you just want to, but use it as a reference. Finally, at the end of your clinical objectives is your clinical evaluation tool that is specific for maternal newborn, that you will be responsible for completing your self-evaluation at the end of your rotation. And that's it as far as your objectives are, and what clinical is going to be like. And finally, before I let you go, I will go through the forms that are provided to you and what your project is about so that you'll be clear. This document is called Appendices for Nursing 2046, Spring 2018. The documents included here are the profiles for labor and delivery, postpartum, and newborn. The very first sheet before each set of documents gives you an idea of things you should be looking at and things you should be documenting on these forms to get a satisfactory on your clinical documentation that you're turning in. Here again, any questions you need to ask. The first set of documents, which are editable, because remember, your documents that I want you to put into Dropbox, they need to be typewritten. It's very hard to read handwriting, and since this is your clinical documentation for this particular client, it needs to be typewritten. There's the labor and delivery client profile with instructions. There's the postpartum client profile and assessment with instructions. Now, the thing that students often do not do and they fail to understand, there are some bolded labs on the postpartum profile. The bolded labs are ones, whether they're drawn or whether they're not. We are looking for you to document what a normal value is for these labs and why are they important for either a mom who is still pregnant or a mom who has delivered and is postpartum. Don't go looking in the textbook and say a WBC, abnormal WBC means hyperthermia or some crazy thing that's in the book. Why is a postpartum client's white blood cell count elevated? Possible infection. Why? Why is a postpartum client's hematocrit low? It may be related to a traumatic birth. It may be related to a hemorrhage. Why is hers? Why is this particular client's low? So every lab that is bolded, even if it was not drawn, I want you to put what the normal is and why is this lab, the rationale, why is it important to this particular client. Then there's the bubbly postpartum checklist. Your clinical instructor will be responsible for getting that checked off and giving it back to you. There is your jot sheet listed there that you will be using on your clients. And then the newborn profile and assessment of what you fill out, what the instructions are. And there is a worksheet that might be easy for you to use if you're assigned to newborn nursery that day. It's just a helpful sheet for you. You don't have to put this in with your clinical paperwork, but as you're assessing your baby with the nurse or with your clinical instructor, it's a real good sheet to just circle what the assessment components are instead of spending time trying to write everything. Okay, so that's newborn. And then there's an APGAR sheet there to just give you a reference of what one looks like. You don't have to turn this in. This is just one that you can jot down what your baby's APGAR 8 and 9 APGAR scoring was. I apologize. I'm going to let that ring so that we can get finished. The final document on your clinical reflections, and this is one that's going to be included in your project, but I put it in here so that it would be a weekly document for you to make sure you don't forget to fill out of your reflection for the week. What did you learn? How did you collaborate with the staff and the other nurses? What was a safety concern that you saw? Because we see them all the time. A lot of students always, whenever you're sitting back watching and observing, you can observe a lot of things that could be a safety concern for your client. So these reflections, one for every week, and you're going to type them up and save them to go into your project. And I've left another clinical evaluation tool in there for you for your reference. Okay, the final document we're going to go over is your project and the grading rubric, just so that you have something to listen to and look at while I'm talking to you, and you're still going to ask more questions, which is perfectly fine. Your OB project is that all project work must be typewritten. We follow APA criteria, and your formal, this is like a formal paper. It must follow the rubric guidelines, and all of these components must be addressed to receive credit. So here's the thing. You are in clinical. You have to turn in a labor and delivery profile with a concept map. You have to turn in a postpartum profile assessment with a concept map and a jot sheet. You have to turn in a newborn profile with an assessment, a concept map, and a jot sheet. If one is missing, you won't get credit for clinical, because those are part of the outcomes that you have to meet to pass clinical. So if your instructors like Cabrini, we have volume issues there sometimes of not enough labor and delivery. So you need to keep your instructor reminded. I still need to be assigned a laboring client. At Rapides, you have strict assignments because we're going to 3 different places all the time. I still need a labor client. I still need a postpartum client. I still need a newborn. You know how many weeks you're in there, and so it'll be your responsibility to make sure you have one for each of those. So the clinical work components are those that I just told you: labor and delivery, postpartum, newborn. For your formal paper, which is the other part of your project, is APA formatted, which means there's a cover sheet and a reference list that includes the information that you've gathered on labor and delivery, your postpartum, and your newborn client. No identifying or confidential information. And the information that you have uploaded in Dropbox, I will refer to that information while I'm reading your formal paper. So, the labor and delivery client that you took care of, aside from her profile and her assessment that was done, what were the physiological and the psychosocial adaptations that you noticed in your textbook? And we'll learn about it in class, what the normal are for a laboring client. Okay, so this is normal, but compared to your client, what were the psychological and psychosocial adaptations that your client experienced? And these are written in paragraph form. What was the normal, and then comparing it to your client. And we have to see both. We have to see that you're making a comparison so that we're seeing how you are starting to apply the knowledge that you're learning. Same thing for postpartum. The physiological and the psychosocial adaptations of your client that you cared for. You turned in the profile and the assessment of that client. Now, what did you experience there? So you're going to be having to take some notes while you are in clinical of these aspects so that you can make that compare and contrast of what's normal that you received from your textbook and from other sources, and what were your findings with your client. Same thing with newborn. And then the last part of this formal paper, which you can make it in a separate section, are your weekly clinical reflections. And these are in a separate section in your project. Of course, they are typewritten, and there needs to be one for each week that you were in clinical. NICU is not part of this project. You may be sent to NICU to observe for a day, but we will not have any writings on an NICU client. That is not your newborn that you are caring for. So just please make sure that you're clear on that. Your grading rubric is included in your end of course project guidelines of how you will receive the points for this. There's 35 points will be if everything is done as it is listed, and it goes on from there. You're using at least 3 references besides your textbook, that's going to be worth 5 points. If it's organized and structured so that it reads well and like a professional paper, that's worth another 5 points. If it has no errors and it's formatted appropriately, that's worth another 5 points. So this rubric is very clear on what I'll be looking at when I grade it. If you have any questions, doesn't matter what it is, doesn't matter how many times we've said it, please ask. I've been a nurse for over 30 years. My first school that I went to was LSUA. Ms. Bradford has been a nurse for a lot of years too. Both of us experience in the maternal newborn areas. So any questions you have, please let us know. Quickest response is to email me. If you need an appointment, set up one with me. We're here to make sure you learn all there is to know about moms and babies. So we'll see you soon.